Okay, this is going to be, there I am. This is going to be our last video for Essential Science. Now there will be videos that give you specific guidelines for studying for the NBLEX exam and how to use the two textbooks together to be able to do that. So we're going to finish this last chapter and go over the appendices as well briefly. And remember that you've got all of the YouTube videos to look at. And they are, as you're getting ready to move towards the end of your learning, now it's time to kick in and look at the videos that are, the YouTube videos that are listed for the review process, which are going to take you back through all of the sciences. So, cattail. Gary, stop it. I want to get these done. Okay, here we go. Share screen. Okay, so here are the last 4 systems we're going to work with. And the 2 that we have the most direct ability to influence is the respiratory system and the digestive system. The urinary system and the reproductive system are affected indirectly through the autonomic nervous system primarily. So in your fundamentals book, there are actual methods presented to support respiratory function and digestive function. So you'll want to take a look at that. And chapter 15 in particular, the wellness chapter in fundamentals, also expands on practical application of self-care methods to support proper respiration. So here we go. This should be old hat to you now. You know how to do this. And here is our section of these are the overarching chapter objectives, and these are the specific objectives for this section. So the first part of it is the parts of the respiratory system. And these are also nicely described in the YouTube videos. So questions might be formulated on the NBLEX exam that use these terms. Then we have how the various interface occurs between the nervous system and the circulatory system and the respiratory muscles and all of that, because you should know by now that you can't separate this out. So where we intervene at with massage therapy is the actual mechanics of breathing. The thorax can be seen as a bellows mechanism, and that bellows is the rib cage, and then you've got the diaphragm that closes that from the abdominal cavity. And so if you understand inspiration and expiration and how that occurs, then you're going to be able to make more sense of how massage is applied to the thorax, like you see here, to allow for more movement in the ribs primarily. And the big problem that we have is what's called breathing pattern disorders, and we'll discuss briefly in the pathology section, but we upper chest breathe. And so all of these muscles that should be helpers, auxiliary muscles, become primary in that they're used all the time. And then because they're adjacent to cervical plexus and brachial plexus, and those areas are so crowded anyway for the nerve to get out and transfer up into the head or down into the arm, if nerves get pinched in there, which they don't like, because these muscles are being used for breathing, then you start to get a real circle and cascade of events that goes on with that. So here are all the muscles of breathing. So it's pretty much anything that attaches to the ribs and or the vertebrae, which is pretty much the whole trunk. And then here is this inspiration? I have to look down here. Mechanisms of inspiration, and then the next one should be mechanisms of expiration. Now we're going to look at this in more depth in class because it is such an important area where we can target massage to make very important systemic benefit and achieve some goals here, because the breathing is both voluntary and autonomic, and this is kind of the entryway into the autonomic nervous system. And then as we change the rate of breathing and the amount of air exchange, there might be a little bit, well, more than a little bit of a balancing effect on the oxygen carbon dioxide ratio that you'll find in the blood itself. So here's your expiration. And this discusses how it's controlled along with the respiratory rate. And we have a bunch of reflexes also that are involved in respiration. So while there is not a lot of information specifically right here, every little bit of it is important in relationship to massage. And then we get into our pathological conditions. Many contagious conditions caused by viruses or bacteria will manifest in a respiratory infection. And because how we expel air, we can shed or spread these pathogens. So we've got the cold and influenza as biggies, and now we've got COVID-19. And there will be, I'm sure, others that are expelled back into the environment through droplets and easily then easily spread to other people, become very contagious then. We can have sinusitis, which is congestion in the sinuses in the skull that are there. They're lined with mucous membranes. They're there to make the whole skull case less heavy. And so if there is irritation in through there, then the exchange of mucus to carry the pollen or the other particles out gets interfered with. So that then creates persistent inflammation. Sore throat can come from a variety of causes. It is a common general symptom of more severe respiratory conditions. And so if somebody, the cat is just really, if somebody is experiencing a sore throat, then that should make us stop and go, now what is this? Is this secondary to an infection? Is it from postnasal drip because of the sinus drainage? One is contagious and one is not. So that's what's going on there. Croup is an infection that mostly occurs in children, and it closes off or causes the obstruction of breathing. Pneumonia is very serious, and it is a major cause of death in the elderly. And so pneumonia can be bacterial or viral, both contagious, and it can also be chemical if you breathe in chemicals and then you get this fluid volume increasing in your lungs. Asthma is an inflammatory issue, and chronic obstructive pulmonary disease usually occurs in the elderly, often occurs with the secondary to smoking or some other irritation in through there. And it destroys the ability for the lungs to exchange oxygen and then pick up the waste products. Pleurisy is an infection of the sac around the lungs. We know what cancers are, so if it's occurring in the lungs, it would be lung cancer. Tuberculosis is very contagious, and it is treatable, but that it also causes chronic inflammatory responses. Cystic fibrosis is an inheritable condition that, again, involves a lot of the mucous membranes and inability to move it. And it's getting better and better at treating it, but it can reduce the longevity of people with cystic fibrosis. Choking is when we get something in the airway and it is cutting off blood flow. Sleep apnea, this one can cause a lot of issues that you would not necessarily connect with things like cardiovascular disease and diabetes and anxiety disorders. And so this is where there's interruption in the breathing, and this is treatable too with an external device. They have something implantable that's electrical, I have seen recently described, and it must do something to keep the airway open by changing the signaling to the muscles in the area. Carbon monoxide poisoning, it replaces and binds with the oxygen receptors on the blood. So this usually happens when there's a faulty furnace, or if somebody is trying to heat with like a kerosene heater, you can become exposed with that. Emphysema is another condition that develops over time, and usually lots of times when you see people walking around with the cannulas in their nose, it is either related to the chronic pulmonary obstructive disorder and or emphysema. Then here we get to the breathing pattern disorder. This is where we really can help people. So in a nutshell, what happens is we're breathing in excess of demand. So the oxygen levels are shifting in the blood, and we are preparing or signaling our body for a fight or flight response. And the symptomology we get in this is that normal fight or flight response, sympathetic autonomic nervous system overdrive, but we're not moving, or we're sitting still, or we wake up with it, or we find ourselves even habituating to breathing in excess of demand. And then these symptoms start to appear. And this can be very confusing because there isn't anything really wrong. It is a over-breathing, triggering sympathetic function when we don't need that. And so you see it develop during stress conditions. And what is important for you to acknowledge here is that if the person goes, maybe they have cardiovascular symptoms with this, if they go and have a cardiac workup, probably nothing's going to show. And yet that person is still going to have times of distress. And if the breathing can be more normalized, and the person has to also have breathing retraining and understand what's going on with them, and they can learn to breathe without using their auxiliary breathing muscles, then they're going to do much better. And so our role in all of this is keeping the torso, the soft tissues of the torso and the springiness of the ribs as optimal as is possible. And so we can do that with general massage approaches that target that area. We don't even have to get real specific with it. Now in class, we'll show you some methods that more specifically target the facet joints, which is where the ribs tie into the vertebrae, and the making sure that the more global muscles are not restricting the movement of the ribs, and that the fascia component of it is not also so stiff that a person cannot breathe using their diaphragm. Okay, the next section is the digestive system. Also in chapter 15, there's a segment on, in Fundamentals of Therapeutic Massage, there's a section on nutrition that would complement this area. For some reason, the MBLEX exam item writers like to name pieces of the digestive system, so it's worthy of knowing what each of these areas are, especially the various segments of the large intestine. We also have to stop and think about, now this may not appear on the MBLEX exam, but we have to stop and think about how the gut microbiome works to help us regulate homeostasis, and the neurotransmitters and hormones that are interfaced in there, and that along with the enteric nervous system, which is part of the autonomic nervous system. Research is just starting to come to fruition about the importance of this. So here's all of your parts. And also, there seems to be questions targeting on the MBLEX exam on the mesentery, omentum, and peritoneum. Kind of like when we were studying bones, they like to have names for the covering of the bone, the periosteum, or when we were looking at the nervous system, the dura mater, pia mater, arachnoid mater, the coverings of the central nervous system. So pay attention to that. And then we get into a little bit of discussion here about adipose tissue in general, and maybe a little bit of an understanding of what is happening in our society related to an increased tendency to store fat. So then we have our parts: mouth, pharynx, esophagus, stomach, small intestine. There are your pieces. And then this practical application is talking about how the large intestine may be surface enough in some people that we can affect it to support peristalsis in the area, and thorough massage of the abdomen may also support the natural jiggling and wave peristalsis of the small intestine. These are our organs that are also part of digestion. We have our pancreas with digestive enzymes, the liver that is so important, and it's such a good organ. You know, it retains its ability to regenerate, which I think is particularly exciting. But it's a cleaner, does a lot of cleanup for us, and it's a reservoir of some of these vitamins that are so important for metabolic regulation. Gallbladder is also part of the digestive function and releases bile as an emulsifier, releases it into the small intestine to help process fat. And then the large intestine is where water is absorbed and more solids, solid waste matter then is eliminated. All of this is highly innervated. So again, you cannot separate one system from the other. And the vagus nerve, through the, as it initiates parasympathetic stimulation, is a big aspect of digestion. And there are studies that show that massage affects vagal activity. So you might want to look that up on PubMed. So here's the whole digestive sequence. Here we go. And then we get into the processing of these, the intake, the food intake, into energy that our body uses. And so here's your main food groups and the different components that they break down into. And you know, things are listed as carbohydrates, proteins, lipids, which are fats, vitamins, minerals. This is a really good overarching diagram here that really puts that into perspective. You will not be asked to break down the citric acid cycle, but you should know that it's part of how food is processed to become nutrient for our body. These are all the different digestive secretions that we have and what they do. This box breaks some of this down for you, and this I would pay attention to, the various steps in the digestion process. So our society is dealing with weight management and metabolic rate and how we burn calorie and or store calories is one of the areas of research with that. So they'll often measure that, and it can be affected by the size of a person, the age of a person, and the thyroid hormones are very much involved with this. Here's a chart on your various vitamins, just to have a general idea. Body temperature has to do with this metabolic rate. And then we have medications and how they can stimulate or inhibit metabolic rate. Here's your chart on minerals. And then here are our pathological conditions. So obesity and weight loss surgery, this is going to become very common, and I strongly encourage you to understand what bariatric surgeries are and the long-term effects of that. And you can find that information expanded on Medline Plus, and then you can go from there. Eating disorders are not really about food. They're more about a person's mental state, and so their sense of control. They are serious, and if you see the warning signs of this, this would be an indication for referral. Constipation, simple constipation, thorough massage of the abdomen. You don't have to go real deep, but thorough massage of the abdomen has been shown by research to help this. Probably because it mechanically pushes things around in there and encourages normal peristalsis, but also through regulation, affecting regulation through the autonomic nervous system. Here is the gut microbiota dysfunction, and there's, I think it's down in here a little further, there's C. diff. That's a disruption in the gut bionome, and can show up as well in a lot of these bacterial-based diarrheas. And we got parasitic diarrhea. And then we have our inflammatory, our autoimmune conditions. So obviously, if the stress response is managed, then these are going to also be managed by our own body a little bit better. Reflux, the issue here is that it can be misdiagnosed as other way around. Cardiac conditions, cardiac symptoms, especially in women, can be misdiagnosed as reflux. And so you need to be aware of how you are going to screen for that. And not just assume that it's GERD. Ulcers, there's usually an underlying bacterial infection here, but the stress response also is involved. Appendicitis is a life-threatening infection that needs to be considered a medical emergency. A hernia is a perforation where parts of the intestinal system are protruding outside of the container that they're supposed to be in. And they can get, the problem with these is that the blood supply can get cut off. So that requires a surgical intervention if it's going to have a repair. And you don't want to massage around or in a herniated area. And then there's a hiatal hernia where you get a movement of part of the stomach through the diaphragm, and that can contribute to GERD too. Some people have the inability to digest certain types of nutrient, and they have to be very careful with their diet. Diverticulitis is where pockets, small side pockets form in the large intestine. The persistent irritation that occurs with those pockets becoming clogged with fecal material is potential for cancer. So you have to watch for that. None of this we're going to be able to directly affect with massage. Cirrhosis is a deterioration of the liver. Gallbladder disease is usually obstructive. There's a tendency to form gallbladder stones, mineral type deposits, and that can be extremely painful. And the issue we have here, or with liver or with pancreas, is that the symptom, the sensation can refer to the surface of the body, whether it's the shoulder or middle of the back, and we need to beware of these viscerally referred pain patterns. And there was the charts in the text that were highlighted earlier that said, now pay attention to this. So this is a little bit of a kind of a chart of what happens if somebody's got cirrhosis of the liver. And there should be one. Nope, that's the only one for this chapter. And then we have obstructions, which is a blockage. This one can cause a lot of sensation that you need to expel gas, gastroparesis. Everything is just so slowed down that there's a discomfort there. It's kind of hard to treat if that is something that somebody has. Smaller, more frequent meals might be part of this, but because there's such a full feeling in the area, people might be uncomfortable laying on their back for long periods of time. Pressing in that area might feel uncomfortable. Cystic fibrosis is a gland function. It is dysfunction. It is under research for being treated. It's inherited. We have to always know if a client has a condition like this and adapt appropriately. Pancreatitis can become very serious, and it is also, the symptoms are also very common to all the rest of these symptoms, which is kind of a yuck feeling, pain kind of in the, the general area, nausea, So we can't always tell what these gastrointestinal symptoms are, and because it can be reflective of something more serious that has yet to be diagnosed and treated, and many of these can be treated, that is an indication for referral. Not a medical emergency necessarily in general, but certainly a referral. Now, acute pancreatitis is a medical emergency. And if you have a gut feeling, haha, this chapter, it would be one where you would go, you should have this checked right now. And then colon cancers and stomach cancers, treatable if found early. Hard to diagnose. The symptoms sometimes don't display or don't show themselves until it's in latter stages. So encouraging people to have regular screenings as part of their own health care is something that the massage therapist can do. Okay, this area, this is going to explain a lot of the same things I just mentioned. And then here's your little summary. And then this is some information on how you can actually massage in the abdomen area to support colon health. And so you might want to slow down and pay attention to that. All right. The next two I'm going to briefly describe because there isn't a whole lot massage directly can deal with. That doesn't mean that this content isn't important. It just means that the information that you glean from reading the chapter plus the videos I posted is sufficient for you to function as a massage therapist and to challenge any of the questions around this content that might show up on the MBLEX exam. So here are the parts, and here's, you know, remember I've said multiple times we're watery, we're very watery, and where is that water located? And the main function of the urinary system is to purify water and then return it back in a water conserving method. So pay attention to the box here, functions of water and human physiology. Too much of a good thing can become a bad thing. Not enough of a good thing also is a bad thing. And, you know, some of the mechanics around how the kidneys use hydrostatic forces to filter that water, and the maintaining of electrolyte balance. And if this becomes out of whack, like in a heat injury or a heat illness, a hyperthermia, hypothermia, if somebody sweats too much, then secondarily this is going to affect the electrical processes, and then could affect the heart rhythm, which then is very serious. And then here are our pathological conditions. So if there was an area maybe that massage may have some more direct influence in, it would probably be in management of simple edema, which is increased fluid in the interstitial spaces between the cells. Do be aware that bladder infections and kidney infections, especially in the elderly, can alter mental state and go serious very quickly. Incontinence is common, and so we want to be very aware of that and make sure that our clients understand that they can ask to use the restroom, and that if there should be some urine leakage, that we do understand that, and we need to be confident in having these discussions with our clients. Kidney stones are very painful. It is very unlikely that you would see a client while they're actively dealing with kidney stones. This kidney stones, various other kidney conditions can manifest, however, as a backache. And so we can't assume that backaches, even down into inner thigh and into the hip, with those referred pain patterns that we have, visceral referred pain patterns, we cannot just assume that it's musculoskeletal or somatic. We have to think of a visceral involvement, because if that is the case, then the condition certainly needs to be referred. So Smokey is back with her crazy tail. And here are our indications and contraindications. Mostly we need to be screening and monitoring, be an observer where somebody might be attributing their symptoms related to the urinary system to something else, and it really should be looked at by a healthcare professional, a physician. Okay. Finally is the reproductive system, and the arena that massage therapy interfaces with this the most is pre and postnatal massage. And so as you're reading down through this, you're going to want to keep that in the back of your head. There certainly is an overarching hormonal nervous system regulation in the reproductive process that has effects body-wide. And this can give you a little bit of insight into how that occurs. And we would want to watch for how this might be affecting the mood status or even the fluid status. Some of the reproductive hormones influence fluid retention, for example, or clotting factors. So here's the female reproductive system. And again, the side effects related to contraceptive methods, and there can be some implants. So make sure that you know if there is an implant. Sometimes they'll put it in the arm, and you don't want to massage over that. So here's our expanded information on pregnancy. If this is an area that you want to work in or specialize in, I refer you to Chapter 14, Adaptive Massage and Fundamentals of Therapeutic Massage, and bring these two sections together. And then the various stages of birth. So here is an overview of lactation and the hypothalamus and the interaction of the pituitary gland. If you're working with a nursing mother, you might find that there could be some leakage from the breast because massage does stimulate does interface with oxytocin. And as I said in the adaptive chapter, chapter 14 in fundamentals, I really think that massage therapists should have more awareness of working in the postpartum period. So here's Luke with a little one. And also, don't get caught up in the myths surrounding massage and pregnancy. That you're not going to cause a miscarriage by messing with points on the ankles, for example, and some of these other myths that tend to circulate, unfortunately, still through the massage community. So here again, there's not a lot that we're doing directly, but we can be part of the surveillance and monitoring and educating and helping a person understand what's going on during pregnancy, for example. And we should be aware of the signs, especially for specializing in pre and postnasal, of an abnormal pregnancy, something that is not going right. And when in doubt, refer. When in doubt, refer. The breast lumps, because you can have cystic development around the lobes for lactation, but this was discussed more thoroughly in chapter 11. So then we have the cancers in the area, ovarian cancer, cervical cancer, various other types of uterine cancers, and the infections that can occur. Endometriosis is a pain producer. Massage may have some implications in generalized pain management if somebody experiences this condition, but you're not going to deal with the overgrowth of the tissues directly. Some people say that, and this is not true in my opinion, that massage can help with infertility issues. If it does, it is because of the relaxation response and a more normal homeostasis. There is no specific massage for that. Sexually transmitted infections, we can come in contact with fluid that may be a way of transmittal of the disease. It's not very likely. So herpes simplex is not always in the genital area. Often it's on the face. So these would be conditions that we would want to be cautious of so that we are protected. Okay, so this ends this chapter. You've been through this. You know what this justification activity is as well, because you did one in chapter 11. I'm likely to have you do one in chapter 12. And here is your critical thinking, critical reasoning question that you are going to research, and the author's response is on Canvas for you. You know where to find those. These would be the points you would discuss. Oh, cat, cat, cat. Smoky, smoky, smoky. And here are your questions. And you should also be well-versed in how to use these to review the chapter as well as to study for the NCLEX exam. That takes us to the appendices. There are 3 plus the glossary. And so this quick muscle chart is a really nice study. It gives you the function action, the name, the function action, and the typical pain pattern that clients would experience. And as we get to the end of that, this is a nice little thing. This is like a mini pathology text. And it goes through and it covers the most common pathologies that you're likely to get tested on the MBLEX exam. So pay attention to this. Now, there may be others tested, but these are the most common. And then this is your example on how to do those clinical reasoning activities at the end of chapter 11 and 12. Glossaries are important. 10 terms a day. Once you get through it and finish them all, read 10 terms, start at the beginning again. Many times people struggle with that MBLEX exam and for reading research papers and stuff too, because they get lost in the terminology. And then lists of references that I used and Luke used as we pulled the chapter together for you. Some recommended reading. And then your index. And what's nice about the index is that if you click on here, like acetabulum, it'll take you right to it in the textbook. So, ta-da, and I think I look like it too. It's from Frighten the Cat here. That has been our journey through the sciences, and you will want to continue to explore anatomy, physiology, biomechanics, use critical thinking to create beneficial treatment plans for people with various pathologies. The sciences are the basis for plausibility, and especially if we lack evidence. So concepts of mimic normal only can occur if we understand what normal physiological function is. So your science studies are important, have been important, and continue to be important. And you will want to focus on the science aspect of your studies for the MBLEX exam. That seems to be where people get caught up the most. And because this whole book took the sciences and presented them through the lens of therapeutic massage, I think there's a lot of value in that as you not just prepare for that MBLEX exam, but prepare for your journey as an excellent massage therapist. Okay, we did it, I think.